Welcome! We often take our health and well-being for granted until something goes wrong. We're here today to ask you to stop and think about your health and take action. Share Cancer Support is dedicated to educating and empowering anyone who has been diagnosed with breast or gynecologic cancers. We're also committed to teaching you about the signs and symptoms of these cancers so that you can recognize them in yourself or your loved ones. Cancer can be scary, but one of the best ways to defend yourself is to learn about it. In this presentation, you're going to meet a leading oncologist, dedicated advocates, and inspiring patients who are part of our shared community.
I was diagnosed with stage 3 breast cancer last year. I felt a big lump in my right breast, and I also had a little bit pain. I went to see my GYN doctor, and then I had a mammogram, and then it led to biopsies and then a single mastectomy. I started my chemotherapy for 4 months, and then I have radiation therapy for 5 weeks, from Monday to Friday, every single day. Currently, I'm on hormone medicine, which is AI. According to my oncologist, I have to take AI for another 10 years. Yeah.
A new lump in the breast or armpit is not the only sign of breast cancer. In fact, you can have breast cancer without experiencing a lump. Instead, you may feel pain in any area of the breast, or irritation or dimpling of breast skin, or thickening or swelling of part of the breast. Another sign to look out for is nipple discharge that isn't breast milk, redness or flaky skin in the nipple area, or the breast, or even a pulling in of the nipple or pain in the nipple area. Of course, any change in the size or the shape of the breast needs to be examined.
I was diagnosed with uterine cancer in November of 2013. It was after having some heavy bleeding. One morning I couldn't get myself out of bed, and so I ended up at the ER. I was dismissed at first due to, I believe, me being a Black person, and also my age, because at the time I was in my early 30s. I was told that they would give me some ibuprofen and a letter for me to take some days off at work to rest. And I pushed back and I said to him, I know something's going on with my body, and I'm not taking ibuprofen because if I'm already bleeding, that can cause more bleeding. At the time I was a nurse, so I knew that. They actually got me in to have a transvaginal ultrasound. So at that point, they recommended that I see a specialist, which is how I received my diagnosis of uterine cancer. My advice to a patient who's being dismissed by their doctors is to know their rights as a patient in terms of being treated with dignity and respect. Advocate by yourself by telling them, what's going on with you, that these things are abnormal, and that, it is your right as a patient, to be seen and to be seen further and have your questions answered.
For ovarian cancer, the most common symptoms include abdominal bloating or pelvic or abdominal pain. Difficulty eating or feeling full quickly can also be symptoms of ovarian cancer, as are urinary symptoms such as urgency or frequency. There can be additional symptoms that are less common. For uterine cancer, if you have vaginal bleeding, spotting, or brownish discharge after menopause, or if you are younger and have irregular or heavy bleeding, these are signs you need to have checked out. Don't ignore pelvic pressure or pain, And if you feel a mass in the pelvis or have lost weight without trying, please talk to your doctor. There can be additional symptoms that are less common. Human papillomavirus, or HPV, can cause several types of cancer, including cervical cancer. It is important to understand how this common sexually transmitted infection, or STI, may lead to a cancer diagnosis. Nearly all sexually active people are infected with HPV at some point during their lifetime. Most infections do not lead to cancer because the immune system is usually able to fight them off. Cervical cancer is highly preventable due to screening tests and the HPV vaccine. Symptoms of cervical cancer can include losing weight without trying, abnormal bleeding after intercourse, between periods, vaginal discharge, abnormal periods, fatigue, back pain, and bone pain. So know your body and what's normal to you. It can be helpful to write down persistent symptoms. If changes occur that are not normal to you for more than 2 weeks, talk to your doctor and see your gynecologist. A risk factor is anything that increases a person's chance of developing a certain illness. Having one or more of these risk factors does not mean you will develop cancer, but you can discuss risk factors with your doctor to help you make well-informed lifestyle choices. In some cases, this can include preventative measures that are appropriate to your risk. These are some risk factors associated with breast and gynecologic cancers. You are more likely to be diagnosed with cancer as you get older. Inheriting certain genes and having a family history of cancer increases the likelihood of being diagnosed. Studies show that a risk of breast cancer increases the more alcohol one consumes. Some forms of hormone replacement therapy may increase the risk of developing breast or gynecologic cancer. Being overweight can increase risk of cancer.
Myths versus facts. Myth: if I don't have a family history of breast cancer, I won't get it. Fact: most people diagnosed with breast cancer have no known family history. Myth: annual mammograms guarantee that breast cancer will be found early. The fact is, although mammography is the best early detection tool we have, it doesn't always find breast cancer at an early stage. Myth: breast cancer always causes a lump you can feel. Fact: breast cancer might not cause a lump, especially when it first develops. This is why you should never skip your annual mammograms. Another myth is, breast cancer only happens to middle-aged and older women. But here's the fact: women under 40 can and do get breast cancer, as do men. Myth: the Pap smear screens for ovarian and uterine cancer. Fact: the Pap smear is only an effective screening test for cervical cancer. Myth: uterine cancer is very rare. Fact: in the United States, uterine cancer is the most common type of gynecologic cancer and the fourth most common cancer for women. Here's another myth: I'd know if I had HPV. The fact is, there are generally no symptoms of HPV. Myth: only women can get HPV. And here's the fact: HPV is common in both men and women.
When somebody has a symptom If it involves something strange to you, you should talk it with your primary care doctor. If you have bleeding from any side of your body that is not something to be expected, like menstruation or hemorrhoids or something like that, I usually use 2 weeks as my cutoff. So if you have a pain or a cough or something that lasts more than 2 weeks, you should have it checked. So, because for most cancers, the earlier you get it, the better. When you start on this journey, you need as much help as you can. So that you should ask the doctor up front for what other supportive service there is, be it psychosocial, social service, and if you don't speak the language well, translator services with your visits. They are available in most large institutions in New York and at most large clinics. You make use of it. Don't be shy. You're going to start a journey and you need as much company as possible. As you approach your visit to see your doctor, it's helpful to write down everything that's been happening to you. And then it's also important to make a list of your questions. How long am I going to be out of work? How long will the surgery be? How long between the surgery and the chemotherapy? What should I eat? Should I exercise? Can I drink alcohol? Can I have sex? All those questions you should feel free to ask. That's what the doctor's there, and he or she is more than willing to do that. I guess the first thing that patients need to get is to be able to develop some confidence, because people come in scared. They're worried about what the doctor is going to say. But I think they need to realize that, they are like the CEOs of their own body. And they need to realize that it is their choice in what to do. They don't need to be swayed by the white coat or by the big hospital or big clinic. The fact is you do have control. The doctors have to listen to you. And if they don't listen to you, then change. You are part of the team making the decisions, and not to feel pushed into doing something you don't want. Because the fact is, if you don't want it, whatever it is not going to work. You have to be on board. We can't screen for every cancer, but there are some cancers that are almost preventable. Now, if you have a family history, usually we go by the age of the relative. If they have it at age 35, then you need to start at age 35.
For me, it started with my mother, right? My mother died from breast cancer. So I always grew up knowing that breast cancer was in my family. I made sure, because of my mother, to always have all of my mammograms, my screenings. When 36 rolled around, and now we're talking about this genetic testing, and my oncologist was like, look, I really want you to have that. Your mother had cancer. We don't know about the rest of your family history, because since she died when you were young, you may not have had that conversation, and a lot of families just don't have that conversation. So I did it in my 30s, and I found out that I had the BRCA2 mutation. So mine came out about 90-something%. Around 50, 51, I started having these symptoms. And then within another few weeks, the diagnosis came back that I had breast cancer. I did my surgery. I had what they called a lumpectomy. They took the lump out. I also had a partial mastectomy, and I had a reduction. I think that's the main thing that I want to leave people with: the importance of screenings, the importance of speaking about your family history. Sometimes our secrets are what kill us in our families. And sometimes we don't want to know this information, but we should know this information because it arms us.
There are many types of screenings that help detect breast cancer early. The most common is a mammogram. If you have dense breasts, you may require another type of screening. Check with your doctor about when to begin screening and what type of screening is best for you.
I was initially diagnosed in May of 2016. It took a few visits before I was able to kind of figure out exactly what was going on. and I found out that I had stage 2B cervical cancer. I went into treatment pretty quickly. I did radiation and chemo and brachytherapy for about 3 months, and about 3 months later I found out that my cancer had spread to my lungs and liver. They didn't see it at the time because they were only scanning me from the waist down. I did treatment for 6 months. At the completion of my treatment, they said that there was just a little bit left, but that I had had overall a really good response. And so I thought we were gonna start another round of treatment, but it turns out that after another scan, they realized that what was actually left wasn't cancerous. So the chemo, I'd had a complete response to the chemo. And so I've been in remission since August of 2017.
There is no standard screening test for ovarian or uterine cancer for those without symptoms. The Pap test, or Pap smear, is most commonly used to screen for cervical cancer. The HPV test is used to detect the presence of cervical infection with high-risk HPV types that can cause abnormal cells.
If you experience any of these signs or symptoms, your first step is to talk to your doctor. If you receive a diagnosis, your second step is to call SHARE at 1-844-ASK-SHARE. We are here for you, and all of our services are free. Our trained peer counselors have been through their own cancer experience, so you'll be speaking with someone who is not only knowledgeable, but has been in your shoes. We have helplines in English, Spanish, and Chinese. Our peer counselors can recommend other services for you, such as joining one of SHARE's many support groups or watching some of our educational webinars. We'll keep in touch with you through our newsletter so that you can choose which support services work best for you. Our support groups bring together women at every stage of their cancer experience and includes special groups for young women, Black women, newly diagnosed, Spanish, and Chinese speakers. Our website, sharecancersupport.org, has all of this information and much more for you. We wish you good health and well-being. And remember, know your body, trust your instincts, and you are your own best advocate.